Hi, my name is Dave Elliotte, and I am the Director of Partnerships and Media Relations for Acorn Biolabs. We are a personalized regenerative medicine company out of Toronto, Ontario. We now have offices all the way across Canada and the United States, and we are on a mission to democratize access to stem cells. And how we do that is we are the first non-invasive collection of stem cells from your hair follicles. So it's as simple as plucking 50 hair follicles from the backs and the sides of your head, and that gives us 4 different types of cells that we're able to cryogenically freeze, suspending them in time and stopping them from aging. Those cell types are keratinocytes, fibroblasts, hair follicle stem cells, and of course your mesenchymal stem cells. When we drop those in temperature to negative 190 degrees Celsius or negative 310 degrees Fahrenheit, what we are doing is stopping the aging process, stopping all metabolism, and freezing them in time in that exact state, meaning you can always go back to a younger collection of your stem cells for future medicine. The idea being that in future medicine, the most important ingredient will be your own cells. So we provide you the opportunity to capture them now while they're young and healthy. It's so important because as of right now in North America, you actually can't access stem cell therapy. It's not yet approved. Now, it is approved in other places around the world, and we know that inevitably it will be approved here in North American soil. Whether that's 5 years, 10 years, or 20 years down the road, the question is, how old will you be and how old will your cells be when those therapies become available? Because the issue is that your stem cells age with you, and as they age, they lose their regenerative potential. So if you're thinking about it like an ingredient for a recipe, you want to get the best, freshest, healthiest ingredient you can to make the recipe as successful, and the age of your stem cells is really that mitigating factor. So by preserving them today, you're stopping that aging process and ensuring that you always have a younger collection of your own stem cells to leverage. The most important thing to understand is our process, right? Because we are collecting your stem cells for you, we don't need to do any genetic testing, any epigenetic testing. Really what we want to know is that the hair follicles that we're collecting have all 4 of those cell types. They're completely intact. And then in addition to that, we want to make sure they're healthy enough. So we want to make sure that each follicle has a minimum of 1,000 live cells. So as you can tell, that's not a lot of data for another group to get access to. It's not very interesting, right? And then to answer your second question, which was, what types of I guess insurance really is there that this will remain open? Well, we work out of major institutions in Canada. So we're actually working out of Toronto General Hospital, which is the largest hospital in Canada. Partnerships in place whereby they will continue to bank and keep these samples frozen indefinitely if we are to ever go out of business for any reason. Now, obviously, we're hoping that's not the case, but it is nice to know that there is a backup plan. Now, it is important to know with that backup plan, they are not required to collect more cells, and they're also not required to try to create therapies. That's unique to what Acorn does as a business. However, they will house those cells until such a time that you can either move them or use them. Other areas that you get stem cells from, like you already mentioned, are going to be from cord blood or from umbilical tissue. It's called Wharton's jelly. That is time sensitive, right? You have to capture that at the time of childbirth, and that type of stem cells is not without its limitations as well, right? Right now, cord blood is usable for certain types of childhood cancer, but that's really as far as that goes. Now, when we look at other types of stem cells that people generally access, you're looking to access your fat cells, your adipocytes, or your bone marrow, right? Because you want to get access to those mesenchymal stem cells. Now, as you can well imagine, plucking a hair follicle is easy. We can do that quickly. There's no relative pain. There's no downtime. With fat and with bone marrow, of course, is a little bit different, right? Because now we have to either liposuction out some fat or drill into the iliac crest to get access to the bone. That requires surgery, right? And that's going to require downtime. So beyond the fact that the cost is, of course, going to be higher because you're requiring the use of a doctor to do that procedure, you're also going to require downtime, right? So you're going to have to take a little bit of time off work. With what we're doing, it's 15 to 20 minutes. It can be done over lunchtime, and there's no different to the way you look, right? So as you leave, there's no different to the way you look, and you don't require any rest or recovery. You're paying on average about $1,000 for your collection appointment, and you pay $190 a year to keep your cells banked. So if you can afford the premium version of Netflix that doesn't have advertisements in it, then you can absolutely afford to make this decision for yourself. It is actually available across Canada and the United States. We're offered out of top doctor's offices, so plastic surgeons, hair transplant specialists, dermatologists, and some really high-end med spas. And yeah, you can actually book an appointment right now and go in and have this done. Be done by the end of next week. You could preserve your little stem cells there. What is the mission? The mission is exactly that, is providing access to bank your own stem cells. And the reason is, so our founder, his name is Dr. Drew Taylor, he did his PhD in biomedical engineering and tissue reconstruction with a focus on cellular biology. At the same time, he played professional baseball. After 2 years of playing professional baseball, he ended up blowing out his shoulder. So the first thing he did was fall back on his PhD to try and grow cartilage for humans, right? And what he noticed was it was actually the age of the cells was the biggest limiting factor for being able to create new cartilage. So while he realized that creating and implanting cartilage was going to be a longer play, the really important thing was, how do we get people's stem cells banked now so that everyone has access? Now, I'm not sure if you can tell from my accent, but I am Canadian, and so because in Canada healthcare is free, right? We wanted to make this as affordable as possible, because in the future, you know, the hope, the dream is that these types of therapies where you're using your own cells to replace damaged cells or to grow and replace damaged tissues, right? These types of therapies, if those are covered by the government as well, and the number one ingredient that we need is your own stem cells, we want as many people to have access to those same therapies as well.